Ever wondered why some babies are born with a cleft palate? Today we're going to delve into this topic. Imagine a world where knowledge about this condition is commonplace, where understanding its causes, detection, and treatment options becomes second nature. That's the world we're stepping into today. We'll explore the intricate science behind cleft palate in unborn children, shedding light on the often overlooked aspects. So, stick around as we unravel the causes of cleft palate in unborn children. Firstly, we need to understand what exactly a cleft palate is. A cleft palate refers to a gap or split in the palate or roof of the mouth. This is not a rare occurrence. In fact, it's one of the most common birth defects. The palate, located at the top of our mouth, plays a crucial role in our everyday lives. It separates the oral and nasal cavities, enabling us to eat and speak properly. But sometimes, during early pregnancy, the two sides of a baby's palate don't join together completely, resulting in a cleft. This can range from a tiny hole in the back of the mouth to a nearly complete separation of the roof of the mouth. While it might sound alarming, remember this: a cleft palate is not a life sentence. It's a condition that can be effectively managed with medical intervention. Now that we have a clear understanding of what a cleft palate is, let's talk about what causes it. So, what causes a cleft palate in unborn children? To answer this, let's delve into the world of genetics and environmental factors, two key elements that play significant roles in the development of a cleft palate. However, it's important to note that in many instances, the exact cause remains a mystery, making it a complex puzzle for medical professionals and researchers alike. Starting with genetics, it's not uncommon for a cleft palate to be a family affair. If one or both parents have a history of this condition, the chances of their child being born with a cleft palate increase. This is due to certain genes passed on from parents to their children. However, it's not always as straightforward as inheritance. Sometimes, a change or mutation in a gene can occur, leading to the development of a cleft palate. Next, we have environmental factors. These are influences from the world around us that can impact the development of an unborn child. Certain medications, like those used for treating epilepsy, when taken during pregnancy, can increase the risk of a cleft palate. Other factors include smoking or consuming alcohol during pregnancy, or not getting enough of certain nutrients, like folic acid. However, it's not always one or the other. Sometimes it's a combination of genetics and environmental factors that lead to a cleft palate. For instance, a genetic predisposition might interact with an environmental trigger, resulting in this condition. It's also worth noting that in some cases, a cleft palate can be part of a syndrome, which is a condition where multiple symptoms occur together. There are over 200 syndromes known to include cleft palate as one of their features. While the journey to understanding the causes of cleft palate is filled with complexity, each piece of the puzzle we uncover brings us one step closer to better prevention strategies and more effective treatments. After all, knowledge is power, and in this case, it's the power to bring smiles to faces. Understanding the causes can be complex, but it's a crucial step towards prevention and treatment. Can we detect a cleft palate in an unborn child? This question is likely on the minds of many, particularly those with a family history of the condition. The answer is a resounding yes. Ultrasound technology, a common tool in prenatal care, is instrumental in detecting cleft palate in fetuses. Ultrasound uses sound waves to create images of the developing child in the womb. It allows medical professionals to examine the baby's facial structure, including the palate. This examination can usually be performed as early as the mid-second trimester, around the 20th week of pregnancy. However, it's important to note that identifying a cleft palate through ultrasound isn't always a guarantee. The clarity of the images can be influenced by several factors, including the baby's position, the amount of amniotic fluid, and the mother's body structure. Even with these variables, ultrasound remains a critical tool in early detection. When a cleft palate is identified, it opens the door to a range of possibilities for early intervention and planning. Parents and healthcare teams can begin to prepare for potential treatments and surgeries that may be necessary after the child is born. This proactive approach can make a significant difference in the child's quality of life. In conclusion, while ultrasound isn't perfect, its ability to detect a cleft palate in an unborn child is invaluable. It provides families and doctors with the information needed to plan and prepare. Early detection can lead to a better management plan post-birth. So, yes, we can indeed detect a cleft palate in an unborn child, and that detection can be a game changer. What happens after a baby is born with a cleft palate? This question inevitably arises once a diagnosis has been made. The answer, thankfully, is that there are several surgical interventions available that can significantly improve the quality of life for the child. One of the first surgical procedures typically performed is palatoplasty, a procedure to close the cleft in the roof of the mouth. This is usually done when the child is between 9 and 18 months old. The goal of this surgery is not only to close the gap, but also to help the child develop normal speech. Around the same time, surgeons may also perform a procedure called myringotomy, which involves placing tubes in the child's ears to prevent fluid buildup and reduce the risk of ear infections, a common issue for children with cleft palates. As the child grows, further surgeries may be required. For instance, an alveolar bone graft might be performed between the ages of 6 and 9. This surgery helps to close the gap in the gum line, providing a stable base for the permanent teeth to grow in. Later on, the child might undergo orthognathic surgery, which corrects jaw alignment issues that are common in children with cleft palates. This surgery is usually performed in the late teenage years, once the child's facial bones have finished growing. Throughout this journey, the child will likely work with a team of specialists, including speech therapists, orthodontists, and psychologists, who will provide support in various areas of development. The goal is not just to correct the physical symptoms, but also to ensure the child's emotional well-being and overall development. It's important to remember that each child's journey is unique, and the timing and need for these surgeries can vary. But the overall goal remains the same: to help the child lead a normal, healthy, and fulfilling life. Despite the challenges, many children with a cleft palate lead healthy, fulfilling lives thanks to these interventions. We've covered a lot of ground today. We've learned that a cleft palate is a condition that occurs when the roof of the mouth doesn't fully form during pregnancy, leading to a gap. This can occur due to various reasons such as genetic factors, environmental influences, or a combination of both. We also discussed how ultrasounds can often detect a cleft palate in an unborn child. This early detection can help parents and healthcare providers to plan ahead for medical care and support. We delved into the various treatments available, which often involve a series of surgeries carried out in stages as the child grows. These procedures, while complex, have been refined over the years and can significantly improve the child's ability to eat, speak, hear, and breathe, and can have a positive impact on their appearance and self-esteem. Remember, knowledge is power. Understanding cleft palate can help us better support those affected and work towards prevention and treatment. Thanks for tuning in. Before we wrap up, we just want to say we hope you found this video informative and helpful. If you did, please give it a thumbs up and don't forget to share it. You never know who might benefit from this information. Whether it's a parent, a healthcare provider, or someone who just wants to learn more, you can make a big difference by spreading the word. Remember, sharing knowledge can make a big difference. Thanks again for watching.